Typically, brain surgery is done most commonly for tumours. It goes by the size of the tumour, where they're located. That plays an important role in deciding whether those tumours are operable or non-operable. Apart from tumours, brain surgery is also done for conditions like strokes. When someone presents with a stroke, or a haemorrhagic stroke or a bleeding stroke, and the blood clot is causing a lot of compression in the brain, therefore brain surgery becomes mandatory to salvage the brain and to prevent further damage. When patients present with ruptured brain aneurysms, more often than not, some form of brain surgery is required to treat the aneurysms or to treat the complications of the aneurysms, for example, brain swelling. Patients who present with infections sometimes need brain surgery to remove that focus of infection. It may be something as simple as putting in a small tube in the brain to reduce the swelling and remove the focus of infection. Sometimes a larger surgery to remove an infected cavity within the brain. Certain epilepsy conditions are amenable or treatable with brain surgery, so that's when brain surgery is done. Some patients who have Parkinson's, some form of brain surgery to help treat this Parkinson's or control the symptoms of Parkinson's through certain surgical techniques like deep brain stimulation, for example. Some patients may benefit from awake brain surgery in an instance where a tumor sits on a very critical part of the brain, and operating on those areas may result in poor outcome or permanent deficits. Therefore, these patients undergo what is known as awake brain surgery, basically doing the surgery while in a full awake condition. They feel no pain, but that allows me as a surgeon to safely remove the tumor without causing any compromise to those critical structures. So these are the conditions in which brain surgery is usually done for patients.